to record to the cloud. Okay. I want to thank everybody for coming. I'm going to turn this over to Rita so she can make the intros accordingly. Take it away, Rita.
Okay, well, our guest presentation will be by Shirley Thomas, and luckily enough, she logged in, got everything ready, and nothing happened that was wrong. The whole thing worked. So this is a first, and it's really great to have you. She's a widow with one child and a daughter, and a grandchild. It's 10 months old in October. She moved to Georgia in the fall of 2009, and in the summer of 2010, started volunteering with Senior Connections. And then she went to Georgia Cares through the Atlanta Regional Commission's volunteer program. And now she works with Georgia Cares, and she's one of the 3 staff counselors. So if you'll all welcome her, and then if you will give us a little more of your background, and then tell us all the latest things going on with Medicare and all the things going on, because I know there's quite a bit right now. So anyway, I turn it over to you, Shirley.
Thank you. Good afternoon. I won't bore you with my background. My background, basically, I was a medical social worker in the state of Ohio and retired and moved here and wanted I thought I was going to get another job. That didn't happen, so I started volunteering, and I fell into this, and I love this. Let me see. There is so much going on with Medicare and COVID. It has been changing rapidly, just like when we first went into quarantine and they were telling you, do this, don't do this, do this, no, change, and kept changing. That's just what they're doing with Medicare up until Friday. Just yesterday, we met with Social Security. My head is spinning. I am not going to pretend that I have memorized any of these changes, so forgive me for looking at notes and reading things because it has changed just that fast. Medicare itself, of course, is stable, but they added some waivers. They added some waivers at the end of last year, thinking that that would be for this year, and then COVID came. And then they were rapidly changing things, trying to meet the needs of the beneficiaries. Like one of the first calls, March 13th, they called us into the office and they said, grab your stuff, we're going home, and we will be working from home from now on until further notice. All right, so what does that mean, grab your stuff? So we grabbed our stuff and we came in, and then one of the first calls I got was from a daughter whose mother was in assisted living, and all of a sudden, just like that, she couldn't visit her. The mother needed a doctor's appointment, and she needed to be seen by the doctor because it was something that needed to be cleaned, treated, and then a prescription ordered. The assisted living facility said, you can't take her out. She can't go. Well, she could not go because it would become infected and that would kill her mother, so she had to take her. They said, if you take her, pick up all of her stuff because she can't come back. So then the daughter said, well, what can I do? And will Medicare pay for it? And Medicare is like, well, what can she do? And will she, will we pay for it? It was crazy. That was March. And they just keep on adding waivers. So let me get started, okay? Let me tell you how many. They have added 135 new plans. They have added 85 new waivers. And it's just been crazy. Okay, some of the things are very beneficial, and we're not sure how many of them will remain. Okay, they added it on. So as long as the pandemic is going on, then the new changes will be happening. We have new insurance companies this year. So now more than ever, if you have a Medicare Advantage plan, you really need to read your annual notice of coverage or explanation of coverage that you receive. and make sure that the things that you need will be covered. You need to check your medications to see if you're in the plan that offers some of the discounts for the medication. So now let me try to share my screen and switch over to the PowerPoint. Oh, host disabled screen sharing.
Wayne, if I may, you need to tap on share your screen so she can show her PowerPoint.
Share screen.
And share the sound.
Piece of cake. Share computer sound. Too many options here. What do I need to do? I got this thing that came up that said, select a window application that you want to share. Post attendee Zoom?
There's something else in there.
Oh, I got a whiteboard, Zoom meeting info.
You have to find something that says you want to share your screen with more than one participant. That seems to work for me.
Well, that's a wrong share, isn't it? Okay, how do I get back out of this? That's cute. Where did I go wrong?
Click on share screen again.
Click
Is
on
that
what?
your screen, Wayne?
I'm sorry?
Is that your screen?
Yeah, that's me. That's my grandson.
Well, yeah, is there like a green box at the top saying you can unshare?
No,
Then click on the share screen again.
I'm looking for it. It doesn't show me the share.
It's on the bottom somewhere.
It'll be a bottom.
Oh, nothing's come up.
Okay.
This isn't good.
Move your cursor around.
I am.
I'm going to go to my desktop, Wayne. I'm going to help you out.
A share screen comes up on the bottom of mine.
It doesn't come up on mine. All I got is
You'll have participants chat and share screen.
yeah,
So
I don't have that.
it's on the bottom.
It's not there on the bottom of my screen.
You should have.
You know what? Let's see. What does this thing do? Show grid video? I don't know. What,
Screen is different for the host.
yeah,
Oh.
it's different. All right. Show small active speaker video. Hide thumbnail video. What is going on here? It's not giving me any options.
Is there anything that you can X out, Wayne? Can you X out of that screen without leaving the meeting?
I don't know how.
Okay, so let me just read the slides and.
Yeah. Go ahead.
Okay.
Oh, this is terrible.
You can send them to us later.
All right. So, how Medicare works with persons under 65, because I'm not sure if anyone in your group is under 65.
No.
No? Okay, so then we can move past that one. If individuals have end-stage renal disease, you do not have to enroll in Part B. However, you will need both parts of A and B for Medicare to cover certain dialysis and kidney transplant services. Individuals can return to work if your diagnosis is end-stage renal disease and enroll in your employer insurance. If you did not have free Part A, you won't have to pay a premium for Part A for the first 8.5 years after you go back and you enroll in it. All right, the COVID additions. They have expanded the telehealth services. Now you can visit your doctor, you can have therapy, both psychotherapy and physical therapy, approved and done on telehealth. For home health services, you can have that approved through telehealth now. You will have to have the doctor's statement saying that there is a necessity, is a medical necessity for that therapy in order for it to be covered, but you can have that. Greater access to and control over your own electronic medical records. They're free to copy and take from one doctor to the next now. The state is required to share enrollee data when you are duly enrolled. So if you have Medicaid or Medicare savings program, the state is required to share that information. Before, you had to notify both places. You had to notify the state, you had to notify Medicare, and in some cases you had to notify Social Security, and it should have been automatic through the system. So now the state is required to do that. Ambulances can now transport you to your primary care physician or to urgent care, and not just to the nearest hospital. Now the proposed, this is one of President Trump's executive orders. He's proposed that insulin costs no more than $35 now, instead of the high prices that you were paying. But that is only certain plans have agreed to it and have incorporated that. So it's not all plans. It's not across the board. Beg pardon? And they have new tips in the Medicare and You book now, like what to do and when the new year is coming around, what you should be looking for. There are changes in therapy caps where before you could, if you spent a certain amount in therapy, then you couldn't get any more. They've changed the caps now. All you have to do is show that it is medically necessary. You no longer have to go into the doctor. It no longer has to be primarily a health-related issue, as long as it can maintain your function and or your mood and reduce avoidable emergency room visits. You're allowed to have this therapy. And in certain plans, acupuncture has been approved and will be covered. Persons with end-stage renal disease can now enroll in a Medicare Advantage plan. Before, they could not. You could keep your employer's plan, but you could not enroll in a Medicare Advantage plan. Now they've changed that. The health market plans must send a notice before the individual turns 65, suggesting when to enroll in Medicare and what happens if you decide to keep health market insurance. Before, people did not know and were unsure, and some of them kept the health market insurance and then found out how much more they had to pay for it. Your 3-day qualifying hospital stay has been waived. So you don't have to go to the hospital, be there for 3 days before you can go to rehab. Now, through telehealth and the doctor's treatment plan, if you need to go to rehab, you can go from home now to rehab if there is a bed available. That has been, that has been approved. That's one of the waivers that came in. Especially if you are afraid of COVID, or there's a COVID problem at the hospital, or there's a COVID situation at your home, they work that out. Home health care and hospice can get telehealth approval. So now the nurse will come in like every 2 to 3 weeks, okay, instead of having to come once a week. They have stretched that out. So now she comes every 2 to 3 weeks, and non-care services have been waived to come into the home every 15 to 21 days. For your durable medical equipment, if it's lost, damaged, or destroyed, it doesn't require the usual assessment, prior authorization, signatures, new physician orders, et cetera, you will have to have the medical necessity documentation, and the equipment company should be able to replace your equipment immediately. So as long as you can prove that it is beneficial to maintaining your position and not improving your position, you can get the therapies and the things that you need. And caregiver support is new this year. So now you have to ask your plan if that includes they've expanded payment for respite, if they've included adult daycare, because some plans pay for adult daycare. And if that's included, then your loved one can go from 3 to 6 days to an adult daycare, and the insurance pay for it, just depending upon your plan. Also, they have included home air cleaners, carpet shampooing, home and bathroom safety devices and modifications, pest control. All of that is relative to your medical diagnoses and your conditions, your chronic condition. So let's say you have a respiratory issue and the dirty carpet and the dust mites bother you. You can get your carpets cleaned, and you can get the like HEPA filter system for your home or your room. Okay, that is totally new. From before.
Terminex.
Right. So to sum it up, Medicare covers virtual check-ins, checkups, so that you can connect with your doctor by phone or by video, or even the online patient portal now. So you type something into your medical record notes, and it dings them, and then they have to look at it and they type back. It does cost the primary care physician visit deductible or copay. Your doctor has the right, or the clinic, to choose whether or not they want to charge you. But I'm going to tell you, I haven't heard of a doctor that has not charged for that. If you're concerned about illness, or if you're possibly contagious, there are other ways for you to remain at home and avoid exposure to others. So they want you to be able to be seen and tested at home. Or you think that you might have COVID and you want to be tested. Now, of course, you can go through CVS. They have tent stations. They have Walgreens. So they have testing stations in other places, and you do not have to go to the hospital, clinic, or doctor's office. Contact your Part D drug plan to see if your refills are covered this year, and which insulins, because they have not noted them, which insulins will be dropped down to $35. What makes me nervous is that when I'm listening to his executive order, he is saying that, President Trump is saying that he's opened it up so that it can bypass U.S. pharmaceutical companies and reach out and purchase medications from companies in Canada and elsewhere. And the one thing I would say about that is that they're not FDA tested and approved. Even the things that have been FDA tested and approved have caused medical problems and issues with people. So I want you to be careful about that. Medicare will cover lab tests for COVID-19. You pay no out-of-pocket costs. They will cover all medically necessary hospitalizations. This includes if you're diagnosed with COVID and might otherwise have been discharged from the hospital after an inpatient stay, you're getting ready to go home, and then your test comes back positive, you can stay longer. Instead of you having to stay in the hospital under quarantine, you can be seen at home, or you can go to the rehab. Currently, there are no vaccines for COVID-19. Okay. However, the best thing you can do, and the doctor said that the other day, the best thing you can do is wear your mask. It protects you, it protects others. And make sure you are washing your hands constantly. You're washing the light switches and the doorknobs, things that are frequently touched. And wiping off bottles, cans, and boxes when you go to the grocery store if you have them delivered. And I know some people are saying the boxes, but just think about it. The box, you might pick it up, change your mind, put it back on the shelf. Or you might pick it up, put it in your cart, get to the front and don't have enough money, and then someone else has to take it and put it in a bin, and then somebody else picks that bin up and goes and puts it back on the shelf. Now, how many sets of hands is that? Okay. And you just so far are not sure where it is coming from. Elderly, people with pre-existing conditions, certain conditions have been found to be more susceptible to COVID. And depending upon what your condition is to how difficult it is for you. Private Medicare Advantage plans, the special needs plans, okay? The special needs plans are for people with chronic illnesses, and to qualify for those, you need to have a diagnosis of one of these: alcohol and drug dependence, autoimmune disorder, cancer, but not pre-cancer, HIV or AIDS, certain lung disorders, end-stage renal disease, severe hematologic disorders, mental health, certain conditions, end-stage liver disease, dementia, neurologic disorders, chronic heart failure, stroke, diabetes. And then the plan will tell you whether or not you fit their criteria for a special needs plan. And that includes a lot of these other waivers that I was telling you about: the carpet cleaning and the air filter and the air conditioning and bathroom modifications, okay? You were about to ask a question? No, okay. There are a lot of scams going on. I have to tell you about the scams. You know how before they were trying to get your number. So now they're using the coronavirus to try to steal your Medicare number and other personal data. So whatever they can get from you, if they can get the Social Security number or the Medicare number or everything, your name, birthday, address, phone number, all of your identifying information, they can go and duplicate some of these services. If you get a call or an email offering COVID-19 items, let's say they're tested, they have test kits or they have free masks, and all they need is your Medicare number, hang up or delete the email. Guard your card. Do not give that information out. The FCC offers following tips to protect yourself from scams. Do not respond to the calls or the texts. Never share your personal or financial information. Be cautious if you're being pressured to share any of that information. Scammers often spoof phone numbers to trick you into answering. So they used to have these out of town area codes. Now they have in-town area codes. So you're answering it thinking that it's someone that you know, someone from here, and no, it is not. It is a scammer. Do not click on any links within the text message. If a friend sends you a text with a suspicious link, don't click on it. What Social Security said yesterday, what they are doing is they're trying to push people into opening up a My Social Security website account. And with that, you can see your statements, you can order new Social Security cards, you can order new Medicare cards, and they have added now a representative payee portal. Because before, you had to have been like a guardian and have the authorization in the Social Security office before they spoke with you, shared any information with you, even though you're trying to help take care of someone. So now they have added a representative payee portal. So if you are a payee for someone or a power of attorney for someone, you should look at that portal and see if that would be beneficial, which it definitely would be. If your loved one gets to the point where they cannot give permission anymore, then they're no longer able to sign, they're no longer able to speak it, then at least it will be in there. They ask that you not call the 1-800 number any longer. They want you to call the local office now. So they had stopped giving you the local Social Security office numbers. Now you can go on ssa.gov, look under locator, and then find the phone number for your office. There are no workers at Social Security, she says. Now there are supervisors and managers taking turns and being distant so that they can grab the paperwork. And there is so much coming in because there was so much going on. It wasn't just Medicare, it was also with the IRS and the stimulus checks. And they're still worrying about the stimulus checks. Again, the second set of stimulus checks, they're still working on those, she said. So
those dirty lying sons of bitches have stolen whatever one you collect.
all right, they want you to send documents by certified mail and insure it. You can drop them off and get them stamped. There is security there, and he can get them stamped, but they will not give it back to you. That you just get a piece of paper that you were.
That's why you're voting in person right now.
Right.
She's talking about Social Security, honey.
Your information. They will mail it back to. They promise to mail your information, your driver's license, state ID, marriage certificate, death certificates. They promise to mail them back to you. But if anything should happen, if your mail was certified and insured, they will replace it. They have to replace it. And we asked about the cost of living. COLA has not been approved yet. So she's thinking that by the end of October, they should have decided what the COLA will be. And from there, they will give it to Medicare. Medicare will then decide whether or not their premium charges will go up, down, or remain the same. It usually takes them 2 to 4 weeks before they make that decision. Well, I just want to say at the end of this month, we will already be in open enrollment. And 2 to 4 weeks after that, we will be in November. And people will have already chosen, changed, or somehow rearranged their plans. And so we do not know what's going to go on. And the Office of Insurance and the Center for Medicare and Medicaid Services says that as long as there is a pandemic, these things remain in place. The discounts on the medications, the waivers for additional help for not having to go into the office, the transportation to the doctor's office, all of that remains in place. But you have to call, ask your plan. You have to check and make sure that they will cover for you. Okay, any questions?
What about coupons for drugs? Because Trump had said he's going to issue coupons, or the government?
Well, what he wrote the order for was a $200 prescription card, not a coupon, a $200 prescription card, and for discounting the insulin, and for allowing the insurance companies to purchase medications from pharmacies outside of the US. That is an order. But the order does not have to be, I don't want to say followed, but it's not a law. So they might agree to it and put it in their plans. And I think that's why only certain Medicare Advantage plans have agreed to it and put it in their plans. Or they could put it in their plan and then the pandemic is over and they drop it just that quickly. So nothing is for sure, nothing is for certain. The only thing they said is we have these waivers in place. If it's in your insurance, we vow to honor it. And as long as the pandemic is here, we will honor it. Once it stops, they have the right to stop the coverage.
Do you have a list of those companies?
No.
Okay.
No, it's on the Medicare Plan Finder tool under Medicare.gov.
Okay.
And they just made that up to date on the 1st. Okay, October 1st.
Okay.
So we haven't even seen them yet. This is like, it's changing so rapidly and they're adding different things and they still don't have, they're not sure about the prices of what it's going to cost you for the premium. So they should honor what they tell you in October, but I would definitely suggest that if you're going to change anything, you at least wait until November when they promise to have the new prices up so that you would know. So that when they tell you, well, the only thing you have to pay is $144.60, well, suppose they go up to $167.60, you know? So trying to base your payments off of that. But as far as the medications, the cost of the medications have been set. So that is in Medicare.gov on the Plan Finder, and you can check those tools. And there are new companies like Clear Spring Health. And Clear Spring Health, I was not aware of. I didn't know who they were, so I Googled it. And Eon has been on the Plan Finder and in the plans for EON for the past 2 years or so. And now Eon is going onto the Medicaid side and Clear Spring Health is going into the Medicare side. So they're one and the same. I have not heard good things about Eon. I don't know anything about Clear Spring. So they promise all this good stuff, and unless you know someone that has had either EON, Medicare Advantage plans or prescription drug plans, or someone in another state that has had Clear Spring Health, I would steer away from them this year, even though they promise great things, because you want to hear how they pay claims, how they cover your costs, and how they cover your medications, and whether or not customer service is good before you choose them. That's it.
Ms. Thomas?
Yes.
Me?
Yes.
Okay, great. Thank you. First off, excellent presentation.
Thank you.
Excellent. So I'm going to assume that, well, I'd like you to expound a little bit more on the physical therapy portion of what Medicare is saying. And is that for Medicare, regular Medicare, and for the Advantage plans? And just expound on who is supposed to do what to continue therapy.
Okay. Yes, that does include original Medicare and the Advantage plans. What is happening now is if you are exposed to COVID, if your area has a high number of COVID cases, if there have been a high number of COVID cases at the hospital or clinic that you usually go to, they're trying to keep you safe and let you remain at home and get the care that you need at home. So in your original plan, let's say you had physical therapy and the doctor says for mobility, increased mobility, continued mobility, so many hours of therapy is needed. And you used to have a therapist come to the home and have you do the test to see how well you were walking, occupational therapy, how well you are working out in the kitchen or bathing yourself, okay? That's already in the plan. So what you do now is they can call the doctor and say, we need to extend the services. The doctor will ask you what's going on, will ask them, what improvements or changes, or has it remained the same? And with that, he writes in his notes, or she writes in her notes, that you need continued therapy. And from that, they give that copy to the home health care agency who is coming in, and they can continue for a certain amount of time. And since they've extended it so that the nurses are not coming in as regularly weekly or every 3 weeks, so that's almost like once a month the nurse is coming in to check to make sure. And all you have to do is to maintain. That it used to say that you couldn't get therapy, physical therapy, unless you were going to improve. And a lot of people were denied therapy because of that. Well, the law changed in 2013, but they didn't tell anyone.
Of course not.
Okay? Someone sued Medicare and won. So you're discriminating against me because I'm disabled. Okay.
What else is new?
And they won. And so now you get it so that you can maintain.
And so this has nothing to do with COVID or no COVID. That in our particular case as polio survivors, therapy is important. And so, so long as we can, quote unquote, maintain, there is no cap, there's no limited number of visits that we can have. So the therapist can continue coming to the house so long, keeping us independent and keeping us functioning.
Exactly. And out of emergency rooms, right. There's
keeping
no
us
falls,
off the
burns.
floor.
Right. No falls, no burns. Okay. Yes. You can get it.
And so to initiate that, you would just have to start off with your doctor and asking him for therapy, and then it's all phone calls between the therapist and the doctor. So there's nobody coming in to reevaluate and all of that
phone calls and virtual
paperwork. No more paper pushing.
Yeah, they're Zooming now. Okay, so Zooming. So the therapist does have to come in and work with you. And when they're working with you, they're jotting the notes and keeping track of it. And it is also for psychosocial. So if you say, I've been locked away in this quarantine and it's driving me crazy, okay, it's making me cry every day, You can get services for that too. Okay. Right.
That's good to know.
Mm-hmm.
I have a question.
Yes.
I go 2 or 3 times a week to a benchmark physical therapist, and he told me to please write to my representative, my senators, vice president, and president because of the proposed 9% less pay that they're going to give to benchmark next. And I don't know if that's in place yet or if that's something yet to be determined.
That is not in place. Let me see if I have it here. I just want to tell you that before COVID hit, like I said, some of these services were added to Medicare and the Advantage plans. These waivers were added before on the 2019 plans that came into effect this year. As soon as these things came into effect, the president had his proposed budget for 2021. And I must say, he proposed to decrease the funds for chronic disease self-management, elder fall prevention, family caregiver support services. Now, he just put it in the Advantage plan, but he was cutting the funds for it. Lifespan respite care, long-term care ombudsman program, the National Institute on Disability, Independent Living and Rehabilitation Research on independent living, state councils on developmental disabilities, aging and disability resource centers, state health insurance assistance programs, oops, that's me, community service block grants, low-income home energy assistance program, social services block grants, supported employment state grants, Office of Disabilities Employment Policy, senior community service employment programs, and the National Institute on Aging. Now, in the news, he was adding to everything, but his budget, he proposed to cut the funding for most of the things that would affect us.
Mm-hmm.
I don't know what happened. We haven't gotten anything new. Let me see, when was this? If I have a date on this. This was as of February 10th, 2020. And I don't know what happened to the budget. I haven't heard anything. They haven't shared anything because there was too much other stuff going on.
Right.
You know? So I don't know if the budget changed or even if they had a chance to look at it now, because the things they proposed to cut, they had to rapidly increase.
Mm-hmm. Ironic.
Mm-hmm. So.
Because places like Benchmark, of course, are scared to death because their margin is so thin anyway, and then to reduce that by 9%,
mm-hmm.
Some of them may go out of
business. There are a lot of places that will either consolidate or go out of business.
Well, did they not extend the budget till mid-December, is it, I believe?
Till mid-December? So for another month and a half?
Well, I mean, hey.
Yeah. Yeah.
Half a month and a half, you know, I mean.
Right. Right, but unfortunately, we'll get into plans, and then they may not have to cover it anymore. And will they pass that cost off to you, or is there another way of funding it? That's what we're not aware of.
Okay, well, thank you for the information.
You're welcome.
I have a question. Does what you tell us here apply nationwide? Is it the same in California, Florida?
Most of the changes are the same. Some of the states approved additional waivers that Georgia did not. So I can only tell you specifically what Georgia approved. Like there are some states that have approved structured family care. And for that, the person in the home that could have gone to work but is not going to work because they're being a caregiver can get a stipend and can get paid for being at home to work. But Georgia did not approve that. So you would have to check with your state to see if they added to the waiver and approve structured family care. Any other questions?
You're on mute, Marie.
I should know better. Okay, and so do you touch on the Medicare Part D, the drug plans?
Yes.
Okay, and so I don't want to make it specific, but I know there's different drug plans. The letters are different. I don't know if it's letters or whatever it is. But does the higher the monthly premium, does that dictate more drugs that are covered as opposed to, say, the $17 plan or $50 plan?
No, ma'am.
Tell me what
Not
the difference
at all.
is.
I once did a comparison for someone that had a plan that was $188 a month. And they have had it for several years. And I asked them why? Because they always did. And they had always worked with that particular insurance company, and that was the plan that was provided. It paid no more on the particular medications that person was taking than the $14.60 plan.
Right.
So I have no idea why. It depends upon, that's why you have to do the comparison. It depends upon the insurance company, the pharmacy, and the area that you live in. Mm-hmm.
Mm-hmm. And you know what else I found, just as an FYI? There is an app for your phone that you can get. It's called Good RX.
Mm-hmm.
And I have found that you can do better with that free plan than the one that we pay for.
Mm-hmm. So I'm sorry.
No,
Go ahead.
and I'm just saying, and then it gives you, you can plug in the medicine, what the dose is and how many pills, how many, months or whatever. And then it'll give you all the prices per month or whatever it is. And they'll show you the different, whether it's Walmart or Costco, and they'll give you the name of the store where you can pick up those meds with the different prices. And they're honored.
And
They are honored by
there's no
others.
deductibles.
Well, that's out of pocket, but and that's right. There's no deductible, and it's out of pocket, but it's no different from you're already paying for the drug plan, and then you're also paying, and whatever you're going to pay out of pocket as well.
That's true.
I guess you gotta weigh. You gotta weigh it.
What you do, and I will tell people, you have to have a Part D plan. The government set it up, so you have to have a Part D plan. So you have Medicare and a Part D and maybe a Medigap, maybe not. But just, you have to have the Part D for the prescription coverage, okay? But if you find that these other plans, hold on just a minute, Ms. Nichols. If you find that the other plans, like Good RX, Needy Meds, who else? Single Care is out now. If you find that those cards would give you a better price, or like Walmart has a $4 prescription plan, Kroger's has a $4 prescription plan, they give you a better price than you would get with your Part D plan, I would suggest enrolling in a minimum priced premium prescription plan, because the
Part D.
A Part D, because the government makes you do that, or they'll penalize you for the rest of your life. So, so enroll in a lesser plan that covers most of your medications, and then use your Good RX card to actually pay
Supplement.
for your medication. Right.
Right.
To actually pay for your medications where you get it at a lower price. People that get antibiotics, I'm always telling them, go to Publix. It's free at Publix. It doesn't matter what prescription plan you got. It's free at Publix. Go to Publix.
Okay. I got a three-part question.
Three-part question. Okay.
Okay. What happens if you drop Medicare Part D? I know you can be penalized, what is it, 1/2 or 1% or something like that if you try to rejoin.
Right.
Okay. The second part, if you drop Medicare Part D, will IRMA fall off of your Social Security deduction?
Who's IRMA?
No, for IRMA, they do have an appeal process or a form saying that they calculated incorrectly, that your income is not at that place, and therefore you get that form, you fill it out, and you send it in, and then they adjust it.
There's two IRMAs. One is on your Social Security itself, and the other one is on the Part D. Okay, if we elect to come off of Part D, does that drop that Part D IRMA?
Part D, that I am not aware of. I believe that it would, but I'm not positive. I would have to check on that.
Yeah, because we're getting conflicting stories on that.
Okay.
Make a note of that. And one other question. What is Medicare Blue Advantage Diamond? Are you familiar with that?
No, is that an employee plan? It sounds like an employee plan.
Well, I went to the hospital here back in March, and I had a prescription, and I noticed when I got it through Kroger, but a Medicare Blue Advantage Diamond plan paid for it. I don't know who these people are.
Okay, that's, yeah, it sounds like Blue Cross Blue Shield and an employee plan of some kind, because they usually have codes like that. All right, not a Medicare plan, but an employee plan. They have codes like that, like silver, bronze. Yeah.
They paid for the whole thing. I thank them. I don't know who they are, but you know, they're freaky out of the deal.
Right. Right.
When is the open enrollment plan to change your Part D?
It starts October 15th. I'm suggesting that you do your homework, but don't enroll until November, just to make sure premiums have not changed. Remember, I said COLA's not coming out until the end of this month. So that's October 30th, right? And then Medicare is not going to make up their mind whether or not they're increasing premiums until middle November.
So they're just going to get another $50 out of me.
Right, right. Now you have a Georgia Cares. You have a SHIP program in Florida that's called Shine.
Yes, I'm aware of them.
Okay. All right, and they'll be able to tell you what's going on in Florida specifically. Okay.
Thank you.
Oh, you're welcome.
Shirley, where can I get a straight answer on this IRMA on Part D if I dropped it? If it drops to IRMA? If I drop
you know, you can, honestly, I would say call me. You and I can call Medicare. If Medicare does not know, then you'll have to call Social Security.
All right.
All right. And I say call me, not because I want to get in your business, but when you call 1-800-Medicare, you're getting,
who knows?
the newer workers. I'll just say, okay, the newer workers. And they have a script and they know so much and that's it. Supposedly, we have the number for the seasoned workers that not only know more, have worked there longer, but are willing to look stuff up. So, you know, it's all in who you get, right? It's all in who you get. So
that's the
sometimes
inside scoop.
sometimes 1-800-Medicare, you know, will you get a good worker, but a lot of times they're newer and they don't dig as deep. Just like Social Security sat with us yesterday. So, okay, this is what's happening and this is what we know. And so we have to keep going. Any other questions?
Is
I have a question. Oh, go ahead.
there a program in South Carolina that's equivalent to those other two?
Yes. Let's see. South Carolina. Let's see if I have it here yet. South Carolina is called iCare.
I have a question.
Well, I'm going to give
Who's
her
that
the
other
phone
number
number.
we can call?
Okay, let me give her the number to South Carolina. 1-800-868-9095. That's South Carolina's. Okay.
And what was it called again?
iCare.
AG Care?
No, iCare. C-A-R-E. You're welcome.
It's my ears. Sorry.
Oh, no, I thought it's me. Okay, now, Ms. Green had a question, and then the gentleman was asking for phone number.
Okay.
Ms. Green.
This is not pertaining to, again, thank you so much for your presentation. It has been very, very informative. This is not necessarily related to COVID, but maybe you can help me or either give me maybe your number and we can talk offline. But let's say if I got to the point that I'm not able to stay at home anymore and I might need assisted living, is there a certain amount of assets that dictate how much you have to pay when you go to assisted living, just in case your insurance plan or whatever doesn't cover it 100%? At one time, I understood that you probably needed to have had limited assets or disposed of, liquidated, contributed, give away, or whatever. You know, some people gave it to the church and some people gave it to different whatever. So is there a limited time frame, 3 years, 5 years, or whatever, before you
There's a 5-year look back. You're saying assisted living. Assisted living is usually paid for out of pocket, not by insurance or Medicare. It's paid for out of pocket, and it's usually close to about $4,000 a month. Nursing home placement is usually between $4,000 and $9,000 a month. And so if you have the assets for that, most people have long-term care insurance that covers that. If you don't have that, you have the assets and you're paying out of pocket, you need an estate attorney, because there is money that you can gift family, a certain amount each month. I work in a law office. I am not a lawyer, so I can't tell you how much it is or how you can do it legally, but there is a 5-year look back to see if you transferred any money or property or anything that they would consider something you should have sold or given to them to pay, instead of having basically the state pay for your stay in the nursing facility.
Do you have an office number that you would be willing to, I guess, speak with us if we called you?
Oh, sure.
Okay, thank you.
Sure. My number is 470-552-3162. The state number is 866-552-4464. Press option 4. The state's number is on the back of the Medicare and U book. And so no matter what state you're in, your number is supposed to be on the back cover. But just in case you don't, I do have the list of the phone numbers from other states if you have a question. The ship in other states. Okay. Now, Mr. Wesley. Oh, are you finished, Ms. Green?
Yes, I am. Thank you so much for that information.
You're welcome. Mr. Wesley. Mr. Wesley, you were asking a question. You were asking for some type of phone number?
He cannot hear.
Oh.
He's having trouble with his audio, and I've been texting him back and forth. Wesley, perhaps you can type your question in the chat.
Wayne, can you?
Okay, Wesley, make sure that you type your question to everyone. Then whoever is running the questions will answer the question, will read the question for you. Is somebody going to do that, or do you want me to do that?
Wayne, can
Shirley?
you unmute him?
Well, he still can't hear. I suggested that he sign off and sign back on again, because sometimes that rectifies the issue. He has to be sure that he connects to the internet via audio, via the internet.
Also,
internet
he was muted.
audio.
Also, he was muted too.
Yeah.
So.
Well,
but he can't hear.
Oh, he's trying to get back on. All right.
Okay, maybe that will, sometimes that helps.
There was.
There he is.
There you go.
Okay, now you had a question or you needed something?
Oh, I had a question when you were talking about the numbers to call in for Medicare. And you were saying like the 1-800 numbers, it may be a hit or miss getting an experienced person.
Yes.
Was there an alternate number?
You have to go through us.
Okay, so you still got to dial that 1-800 number.
No, you dial either my direct number or the 1-866-552-4464. Press option 4.
Wait a minute, tell me that again.
Okay. 66-552-4464, and then press option 4.
Okay. All right.
Okay.
Thank you.
You're welcome. Any other questions?
Bernetta has one.
Yeah, I have a question. I have Aetna insurance, and this might be a silly question. Is this the same thing as the Medicare Advantage? I mean, does that come together, or do I have to have Medicare by itself? I think I do.
No, that is an Advantage plan.
Okay.
Does it say HMO or PPO, or does it say PDP?
It does say that, and they have us call into Aon if we have any questions. And usually they just advise us, whether we're going to go with United Healthcare or Aetna. With everything that you were talking about today that was covered by the Medicare Advantage, like the air cleaning, pest control, and whatever. I was just wondering if that's covered by that as well.
See, you have a state plan, right? So each plan is different. The insurance company has a contract with, so your insurance company has a contract with the state. So you have to see if they included that in there, and then how much that would cost you to have it. It is not a direct contract with Medicare. It's a contract with the state. So you have to see how they wrote it up.
And I have to do that before November? I mean,
Well, before
open season is starting, right?
Is the same? Okay.
Yeah, yeah, I'm getting notices now, call Aeon, or, if you want to keep things the same, don't do anything. But I don't think mine covers all of this stuff. And I want to make sure, nothing is left on the table. If I could get this would be wonderful for me. But
That's why now more than ever, you need to read your annual notice of coverage. It's a thick book. It's a big book, but it's worth it to see what,
I got
no, that's
that.
Medicare and you. And isn't our phone number on the back? Georgia Cares on the back?
Yeah.
Okay. But for your insurance company, you're supposed to get a notice of coverage that says, so you have Anthem, it should be an Anthem book and what they're going to cover this year.
Okay.
And how much your tier 1, tier 2, and tier 3 drugs are going to cost you. And then there should also be a separate book with a list of the medications. Someone told me they got their notice of coverage, but not the list of the medications. And I'm sure that's because they were waiting to see if there was going to be an executive order that they could have turned into a bill that they could have, passed in and made it a law. Well, no, it's not a law. It is an order. It's on the books now, but will it stay? So they're going to have to let you know what drugs they're going to cover and what extra waivers they have added to your plan, and whether or not it's going to cost you something. Their contract is with the state.
Yeah.
And of course, the state's a little cheap. So what are they willing to actually pay for?
Right. Well, I'm in Georgia.
Okay.
Well, thanks for that. That's the start.
You're welcome.
Shirley, what were the name of those other drug plans besides GoodRx that you mentioned? And also, can you tell me the difference or the advantages or disadvantages between regular Medicare or the Advantage plans?
Okay. Regular Medicare is national. You can go anywhere in the United States, Puerto Rico, Guam, Virgin Islands. It's covered. All right. Your prescription drug plan doesn't cover like that, but most times when we go places, we're not going for 4 or 5 months. So you can get a 3-month supply and go on your vacation and you'll have your medication and you'll be back home when it's time to have it refilled. That's not a problem. Most of us get them through a national venue like Walmart or CVS or Walgreens. So wherever you go, there is one there and they can check with the CVS here and make sure that you do have a refill so that you can get your medicine. That's not a problem. If you have a Medicare Advantage plan, the advantage is they cover things that Medicare does not cover, like dental, vision, hearing, gym membership, the waivers that I was talking about, the therapies. There's a set price that you pay for those services. Okay, so that's included in the Advantage plan. Medicare does not cover dental, vision, or hearing at all. You get a glaucoma exam, you get your cataracts removed, and the first pair of glasses after you have the cataract surgery. You got preventative health care, and the preventative health care is your first exam of the year, and you make sure that you do not let them treat or examine anything. So if you're getting a colonoscopy and they find a polyp, they're not to clip it and test it, because then it became a procedure and you're charged for that. Yeah, this is basically just asking you questions, taking the test, and looking to see what things look like. And there are a certain amount of time that you can take these tests. Like some of them are annually, some of them are biannually, and there is one that you can only get once in a lifetime. But you'll have to find out from the doctor, well, from your insurance company, which one that is. And On the mygeorgiacares.org website, there is a list. On medicare.gov, there is a list of what those are and how often you can take them.
So there's more restrictions.
That's for the preventative or your wellness visit, for it to be free. Basically, they're asking a lot of questions. They're taking blood pressure, they're taking your vitals, and there might be some tests because you're at risk for certain things that they will take that will be free. But let's say the colonoscopy is free because you're at risk for digestion or colon issues, then they can do the colonoscopy. But if they see a polyp, they cannot cut it and biopsy it, because then it's a procedure. It's not just looking.
So then you have to go through all that nonsense and the prep work a second time. And this is under the Advantage plan.
Right.
Gotcha.
Mm. Oh, yeah. And that's what some people are upset, because they're thinking, well, that was part of my wellness visit and it was supposed to be free. Well, it was free until they cut.
Had a problem.
Right. Until they cut. And so
it makes sense that when you're there, you do that.
Thank you.
Yeah, right. It makes sense. So it's the government. So it's a loophole. It's like, look at it and that's it. Just look at it. Then incur another doctor's charge to go in the office so they can tell you what they saw and what they would like to do, and then have it done. All right. Mostly what they want to do with the wellness visit is to see what your condition is at the beginning of the year, and then that gives them a plan on what they should be working on the rest of the year. So we need to watch this, because let's say your A1C was a little high, is a little close to being diabetic, you're close to being type 2 diabetic, so I suggest that you cut this out, add this, and we'll see you again in 6 months.
So it's more like a managed care plan, like an HMO.
No, it's just trying to see how they could treat you and keep you healthy for the rest of the year. They want to see if anything changed from last year and what might be developing. That's what the wellness visit is for. Okay.
And what were the names of those other drug plans besides GoodRx?
Okay, there's Single Care. That's one word.
Yeah.
There's Needy Med.
Needy?
Needy Med.
Med, M-E-D?
Yes. And then here in Georgia, there is an online pharmaceutical company. Okay. So you can go online and look at them, and that is Good Pill. Goodpill, Good Pill. And they have medications at a discounted rate, and you look at their list to see if yours is on there. Your physician can send the prescription to them, and they will mail the, well, of course, after you register, they will mail the medication to you.
And the Single Care and the Needy Med, is that something that you go online, or is it an app?
Those are cards. Well,
GoodRx is an app.
Yes, I know GoodRx is an app, but Single Care and Needy Med, what are those? You have to just go.
Those are cards. I have not seen them in an app, but that doesn't mean they don't have them.
Where do you get it from?
You can go online and request one. I have some Needy Med cards here. Do I have any? Yeah, I have some Needy Med cards here I can mail to you, but if you want.
So what should I do? Give you my address? Wayne has my address.
I was going to say, someone there should have the address, and I can just mail the cards. Whoever wants one, I can mail that number of cards to them.
I do.
Okay, yeah, just let them know.
And I'm in Florida. So those cards will work? The Needy Med will work?
The Needy Med will work. Mm-hmm.
Okay. Wayne, you'll provide her address for me?
No,
Yeah,
Or Rita.
An address, yeah, an address. I can mail. I think I have Rita's address, and I can mail them to Rita. Just let me know how many you want and how many.
Yeah,
All right.
I'll take care of it.
Okay.
Single Care is an app.
Oh, is
Okay.
it?
So
Okay,
see.
there you go.
Mm-hmm. And anymore, that's what we have to do. I don't see anyone fighting for seniors anymore, really trying to give us the discount and the care that was promised. And so you have to be able to compare and check and find what is the cheapest. And this year has been the craziest because of so many insurance companies jumping out of the woodwork, so many different waivers trying to cover the situations that popped up since March, since COVID came. And there was a doctor from Emory that said, this virus has moved so swiftly and we just have no idea where it came from and how it's going. We haven't found the pattern, and they think they have the pattern now. It's been almost 7-9 months since they've been battling it, because it was started in February, but it was just totally out of hand by March. And so they said it's just moving so rapidly and changing. Before they said, oh, if you're young, it doesn't affect you. And then babies and children started dying. And it was, okay, go back to, and so. Any other questions?
Shirley?
Yes.
This is Brenda Taylor. So most of the waivers that you're talking about mainly all pertain to the Advantage plans.
Most of the waivers pertain to the Advantage plan, but Medicare has promised to honor a lot of that. Medicare was the one that said, this is what we should do. Okay. So I would check with my doctor to make sure that
we have the Medicare, and then we've got just the regular supplement in the G plan.
Mm-hmm.
And then we use silver scripts for our prescription D.
Mm-hmm. So as long as, check with Medicare, check and with the doctor, say, okay, can I text you or email you through my chart? And, is there a cost for that? This is what I'm feeling, and can I get so-and-so, such and such? Yeah. Will you write a prescription, write a plan for it?
I have one question. Now, do the waivers just cover during this virus problem, or are they part of the plans now?
Well, that's what the big wigs were saying. The people from Washington were saying that as long as the quarantine and the pandemic is here, it's covered. They have no idea which ones will continue because it's costing them so much money. Remember, they already had in line for budget cuts, okay? And now they had to expand it, add more waivers. That's taking more money. So now I'm sure they have to readjust this budget. So we'll see.
So telemedicine is also the same way, or is telemedicine permanent?
Telemedicine is going to be permanent.
Okay.
I believe that the recertifications will change. They've been expanded so that you don't have to go as often, so you won't be exposed as often. So I'm sure that they will get back to having to have a face-to-face more regularly and having to have at least one either nurse or someone come into the home more often, once a week or so. Then they, now it's almost like once a month. As long as they do that and you're seen on the computer, you're fine. And that stipend for paying for caring for your loved one. But it's worth checking into if you have an Advantage plan to check to see if you can get some of these home modifications. If that's included in your plan. If the doctor says the dust mites are bad for your respiratory condition, so that you can get these things done while they can be paid for.
Thank you for that good information.
You're welcome.
Bye. I'm going to check out now, guys.
Okay, bye.
See you next month.
Thanks so much, Shirley. This has been really great. I mean, it's been a great discussion.
You're welcome.
Yeah.
Thank you for having me, guys.
There you go. Well, I'll be giving you a call a little later in the week about this perma thing.
Thank you so much, Shirley. Thank you so much for your information.
Oh, you're welcome. Thank you for coming, guys. Thank you for having me.
Thank you so much too, Shirley.
Thank you.
You're welcome.
Thank
Bye.
you. Bye-bye.
Bye.
Now, I have a few things that I read our email regularly, and in that I found that the statewide Council of Georgia for Independent Living is having a board meeting October 8th at 1 o'clock. So if anybody would like to Zoom in, if you can just email me an email and I'll send you the link. And also, let's see, WHO said that the eradication of the wild polio virus type 3 is completely finished. And also, October 13th, there's going to be a discussion at 7 o'clock on the polio health crisis versus the COVID-19. It's going to be like, I think it's like a panel discussion. And other than that, I wanted to tell you who our next speaker is in November, and it's Dr. Giza Kogler, and he's a PhD. He has a degree in bioengineering from the University of Strathclyde, Glasgow, Scotland, and he's a professor at Georgia Kennesaw, and he was at Georgia Tech, and now he's at Kennesaw. And his current research interests include powered exoskeleton systems for rehab, sensing applications for diagnostics and muscular skeletal health, foot ankle biometrics, and plantar foot mechanics. And he'll be giving us a little discussion on the use of muscle and any of the orthotics, anything that pertains to his research. And that at one time, and I'm not sure, I haven't gotten to talk to him in the last couple of days, but he is interested in having help from some of us. So that ought to be an interesting discussion. And